So it has been proven that there are instances where there is a gap between religious teachings and practices. Hence, risky behaviors that may not be allowed by Islam are indeed practiced by some, especially the youth. For those instances and the rising number of infected persons within the community, especially the refugee, the following should take place. It's not taking place, but it should. We have a habit of, keeping a blind eye. It doesn't happen to us. It happens to another community, but it's not going to happen to us. The reality is, and the statistics are saying it's happening within the Muslim community. So let's wake up and do something about it. So us Muslim scholars and leaders should be addressing the underlying societal problems such as poverty, lack of education, gender imbalances in their Friday sermons and beyond. So, on Fridays where we have a huge number of people coming to Friday prayers, let us address these things. Let them be getting more education themselves, involvement and mobilization in HIV/AIDS so they can be beneficent in raising awareness and dangers of reckless behavior. Be part of a collaborative prevention and care models, including all possible stakeholders such as academics, expert health professionals, public makers, non-governmental organizations, community-based organizations, and HIV-positive persons. They need to be on advisory committee for development and provision of appropriate healthcare resources and infrastructure to cater for the Muslim sufferers. They should advocate the setup of drug abuse prevention and rehabilitation services. Put more effort directed at enhancing information, education, and communication with youth and high-risk persons. They should be helping in reducing the stigma associated with HIV and AIDS. They should be developing compassion for those afflicted and designing harm reduction strategies which would be conceptually integrated within the existing social, cultural, and religious frameworks in our Muslim communities. So, prevention, we talked about. Now, a person is infected. Are we going to let go of them? They are sick. Priority for us as a Muslim, 1400 years ago, is to look after the sick. Visit the sick, support the sick, pray for the sick. And this hadith illustrated the empathy that believers are required for each other. It says, the parable of the believers in their mutual love and mercy towards one another is like that of a living body. If one part of it feels pain, the whole body suffers in sleeplessness and fever. So if someone is suffering from HIV/AIDS, the whole community should be suffering in emotionally and supporting them. It's a right on the sick person that we go and give them pastoral care. There's 6, the Prophet said that we need to, it's the right of a Muslim, of another Muslim. One of them is visiting the sick. To show the importance of visiting the sick, the Prophet, peace be upon him, in a hadith Qudsi, he said, on the day of resurrection, Almighty Allah will say, "O son of Adam, I became sick and you did not visit me." The person will say, "Oh Lord, how can I visit you and you are the Lord of all that exists?" Allah will say, "Did you not know that my servant so-and-so was sick and you did not visit him? Did you not know that if you visited him, you would have found me with him?" The virtue of visiting the sick is not limited for visiting another Muslim. The Prophet said, whoever visits a sick person is plunging into mercy until he sits down. So a sick, there's no specification of Muslim or not. And when he sits down, he is submerged in it, in paradise. Another hadith, whoever visits a sick person or visits a brother in Islam, so it's, having difference here, specifically saying sick person generally or brother in Islam, a caller cries out to him from heaven, may you be happy, may your walking be blessed, and may you occupy a dignified position in paradise. And that's what we see generally in hospitals when we have someone sick. We've got the Muslims, they come, they huge amount, and because they are competing to be blessed, and with that blessing is two-way. The blessing is two-way. You are getting the blessing and the promise that your prayers to that person will be listened to and he will be healed. So when visiting the sick, the Prophet, peace be upon him, he used to say, O Lord of humanity, take away the suffering, bring the recovery. There is no cure but your cure, a cure that leaves no illness. This spiritual prayer is promised that it's going to heal. So yes, the medicine, the doctors, the supervision, all of these things, but the magic touch, in a way, that spiritual prayer. And because Judgment Day is a very crucial day for any Muslim, they want to be there presented as clean. So part of being ill is cleansing. So when visiting a patient, you say, it's okay, it's cleansing. It's purifying your soul. It's part of your, raising in position in paradise. So whatever illness we have throughout our lives, and HIV/AIDS is one of them, and it's very crucial and significant in one's, being, and with no cure to it. So the person who is suffering wants, some hope, and God promised those who are patient and suffer in, patiently and continue living in a positive manner, the reward is high. So it's part of, the big picture of spiritual height. And this is another thing. So yes, a person is, dying, let's say, a cancer or anything, dying, but the glad tidings, each thing that a person suffers from, it's bringing them more closer to God. Yeah, this is more on the rewards of suffering, how it expiates sins. This is thoughts for us, pastoral carers from a Muslim perspective, and for service providers who are looking after the people who have AIDS. To listen to patient and family, to demonstrate sensitivity and empathy, respect their values and beliefs, and remain flexible. Some of them want to fast, so medicine can be given in the two ends of the day instead of being spread out. So, flexibility is important to accommodate the sufferers. And avoid speculation, respond to who, what, where, and when, provide reassurance, treat each patient as an individual. Muslims vary in culture and degree of practicing their religion immensely. So, if some patient or sufferer is acting in one way, it doesn't mean that another patient is going to act the same way. We've got the diversity of Muslims come from China to America, from Europe to Africa. So the cultures come with those patients as well. And hand in hand, we will be preventing HIV transmission, inshallah. That's the word for God willing. Thank you.